Hi, my name is Stephanie, and this is my ostomy checkoff. I'm going to introduce myself to the patient, and I'm going to get two types of verification for the patient. I'm going to assess the type and location of the stoma. I'm going to I'm going to gather all of my supplies. I'm going to educate the patient on what I'm going to do and make sure that they understand and ask for patient interaction and questions. I'm going to wash my hands, secure the curtain for privacy. Secure for privacy. Then I'm going to make the patient comfortable, sit the patient in a semi-phallus position, leaving the abdominal area exposed where the stoma is at. Okay, after I do that, I'm going to then I'm going to listen to the bowel sounds, check the skin to make sure for any irritations. I'm going to check the ostomy bag to make sure that it's if it's any good. I'm going to check the stoma, make sure for any swelling, trauma, healing. The stoma should be moist and reddish pink. Okay, after that, I'm going to, if I have to dump the bag, the effluent drainage from the bag. I'm going to place a waterproof cloth under the on the patient's side. I'm going to dump the bag of effluents. If it's 1/3 to 1/2 full, I'm going to dump it. But if I have to change the bag, I'm going to peel the bag from each corner and remove the bag and place it to the side in the biohazard bag. I'm going to cover the stoma with a cloth, a towel, to keep it from exposed. Then I'm going to wash my hands and put on new gloves, and I'm going to clean the sites with warm water around the peristomal area. I'm going to clean the peristomal area with tap water, with clean warm water. Then I'm going to pat it dry. Then I'm going to take the pre-cut templates from the box, the pouches, with the pouches came in, and I'm going to use that to measure the stoma. If it's a urostomy, I'm going to cut it 1/8 of an inch, or if it's a colostomy, 1/4 of an inch wider than the stoma. Then I'm going to cover it back up. Then I'm going to, if need, take some barrier paste and place it on the the wafer, on the wafer, and put some barrier tape on the wafer. Then I'm going to peel, and I'm going to place the wafer, center it, and place the wafer over the stoma, pressing it down with my fingers to make sure that it sticks. Then I'm going to ask the patient to use their hands to cover the stoma to make sure that that the wafer seals to the skin. And I'm going to use the clip that I said from earlier and clamp off the stoma, clamp off the bag. Clamp off the bag. Then I'm going to clean the patient up. I'm going to raise the handrails up, put the bed back in the lowest position, give the patient a call light, and do some documentation on the type of stoma, how the stoma looked, the effluent that I drained from the stoma, how the patient tolerated it, any questions that the patient may have had, and that is it.